Society has a persistent, dismissive label for people living with borderline personality disorder. They're simply too much, erratic, exhausting, and overwhelming. For decades, the medical community and the public alike treated this diagnosis as an incurable defect of character, a fixed, unfixable flaw in a person's nature. Clinical research characterizes the disorder as a collection of symptoms stemming from a specific deficit in cognitive tools. This diagram illustrates the biological reality. Left, a typical baseline for processing feelings. Right, the BPD experience processes feelings at 10 times the volume, constantly peaking in the red. This blinking empty slot identifies the developmental gap, missing foundational lessons needed to manually lower that volume. Imagine navigating a world where your brain registers every perceived slight or disappointment at maximum volume, yet you possess no internal mechanics to turn it down. Borderline personality disorder is an equation of missing education, an acquired mechanical deficit rather than a moral failure. This explains why traditional talk therapy frequently fails these patients. Repeatedly venting intense, painful emotions without first possessing the cognitive tools to process them can actually reinforce distress. Effectively managing this level of dysregulation requires systematic instruction in emotional processing. In the late 1980s, researcher Marsha Linehan developed the clinical gold standard to provide that instruction, Dialectical Behavior Therapy, or DBT. DBT operates as an active, rigorous curriculum. It functions as a structured process designed to retrain the nervous system's response to stimuli. By treating emotional responses as mechanical processes, the therapy allows patients to analyze and recalibrate their internal reactions with precision. This diagram breaks down the treatment architecture. The first pillar, skills training, teaches step-by-step actions to tolerate distress. Next, individual therapy connects these skills to real-world triggers. Finally, the coaching capstone locks into place, ensuring tools deploy during active crises. This active, comprehensive structure fills the vacuum of emotional education these individuals experienced in childhood. This specific protocol bridges the developmental gap, supplying the regulation controls that eliminate the chaotic behaviors associated with the disorder. The clinical data is consistent. People who complete a full DBT program show significant, lasting improvement across all metrics of their lives. Once the mechanical regulation skills are learned, they work. The disorder is a treatable condition, not a life sentence. There is, however, a critical hurdle. Accessing this specialized, multidisciplinary care is often blocked by high costs and a lack of qualified clinics in many geographic areas. The most effective curriculum in medical science serves no purpose if the people who require the education cannot reach the classroom. Coping and Healing Counseling, or CHC, delivers specialized DBT-informed care through a dedicated telehealth network designed to remove these barriers. Through a secure, HIPAA-compliant platform, CHC serves all 159 counties in Georgia, providing statewide access to specialized mental health care. They address the financial barrier by accepting major insurance networks like Aetna, Cigna, Blue Cross Blue Shield, United Healthcare, and Humana. For patients on Medicaid, the copay is $0. Their team of over 15 licensed professionals, including clinical social workers and family therapists, are trained to guide patients through this emotional curriculum. No one is permanently too much. They simply need the right tools, and those tools can now be delivered directly to their screen.